Hi and welcome to my YouTube channel. This is my first video I'm making. I'm making this video because a lot of my friends, patients, and colleagues over the years have told me to start my own podcast. While I'm not ready to start a podcast just this minute, I figured it'd be fun to start, recording some videos and doing something before it's too late. You never know. So for some dental inspiration, I thought what better place to go than Reddit. I figure let's just go through Reddit. Let's read what we can find here and see what topics we can come up with. And I'm just going to make random comments essentially as I go through this all. Um, Feel free to comment about anything that I'm talking about and, email me if you have any questions. So let's get started. I've gone to the subreddit called Ask Dentists. I haven't previewed any of this stuff. So let's see what we can find. The first post is titled "Receding Gums and Bad Gums Disease at 19." Well, looking at this patient definitely has some periodontal disease. For age 19, it's not very good. So to start, we look at the patient's lips. Some pretty dry lips here, especially on the bottom. Not too dry. Let's let that pass. That's the ambulance outside. So we've got some dry lips here. Not super dry, but dry enough. Some inflammation definitely in the gums. When we look at the teeth, definitely some staining. And then you can start to see that there's definitely some calculus buildup here around the gum line. It's definitely subgingival as well. There's supragingival and subgingival calculus. That means there's tartar essentially on the tops of the tooth and also underneath the gum. In dentistry, we call tartar calculus, because essentially what tartar is are mineral deposits or calcium deposits in the mouth. So this patient definitely needs to do better with brushing, and flossing, and they could definitely use a deep cleaning with their dentist or hygienist. All right, so that's the first one. Next article: dentist doesn't use gloves anymore. Okay. All right. Hi, everyone. I am normally very happy with my dentist. I go to the same one since I was a child, and my whole family goes there as well. When I visited the last time, though, my dentist did the usual checkup without any gloves. He just washed his hands beforehand. As far as I remember, he never did that in the 20-something years before. I was a bit bewildered and asked why he ditched the gloves, and he said that he wants to save gloves since it's better for the environment, less waste. I care about the environment as well, but I still felt uncomfortable knowing in how many mouths those hands had been before. Is that a valid concern? Should I ask him to use gloves when treating me? ... Well, firstly, yes, your dentist should be using gloves. It's 2024 right now, and it's the standard of care for dentists, hygienists, and dental assistants to wear gloves when working with their patient. Yeah, I mean, even though he washed his hands really well, I'm sure they're clean, but he should be wearing gloves. Gloves have been the norm really since the 1980s. I think around when the AIDS epidemic started in the 80s, we became extra concerned with the spread of disease. Especially in the 80s, we didn't know so much about AIDS. There were a lot of question marks at that time. So wearing gloves really became the thing. And it stuck. Is it a waste and is it not healthy for the environment? Right. I mean, that's rubber going right into the trash. It's not being recycled. Environmentally, not the best, but it's the standard of care. So if you do want to go back to that dentist, I would definitely urge him to wear gloves, or maybe find another dentist. All right, next. Pain in back tooth and decay in top teeth. Do they need a filling or a crown? All right, so remember when we're looking at pictures, we only shows part of the picture. I can't see all around that tooth, and I don't have x-rays of that tooth either. But what I can tell from the surface is that's a pretty big hole. And the decay probably extends beyond that hole. If we were to take an x-ray, I'm sure it would show a lot more decay. With this tooth, it definitely cannot. I mean, you could put a filling in any tooth, but I'm fairly sure that decay is right at the nerve. So likely this tooth is probably going to need a root canal and a crown, or you might opt for extraction and have it removed. It depends on what the x-ray looks like, but I would wager that decay is right around the bone level, and to save it might not truly be worth it. That being said, you definitely need to see the dentist, take an x-ray, see how bad it is. All right, when we look at this other angle, the patient has rampant decay. See the gum line, that's some decay. The patient has some issues with brushing. This also looks reminiscent to meth mouth. People use meth, oftentimes have decay patterns like this as well. Or maybe they have dry mouth. Maybe they aren't brushing there along the gum line, but this patient definitely needs to see the dentist. And they have more issues than just that tooth, I'm sure. We got 7 comments here. I'm curious to see what other dentists say, so let's see what they're saying. So for the record, I'm saying probably it's 50-50. Either needs to be extracted or maybe a root canal and crown. Let's see what other dentists say. This one says that's quickly approaching extraction territory. That's quickly approaching extraction territory. You need to see a dentist and need a drastic improvement in brushing and flossing. That's what I said. You need a lot of dentistry. We can't say what with just photos, but it's also emergency level. Throw away the Mountain Dew. Okay. You will likely need several fillings, some crowns, and an extraction or two. All right. Reasonable. Okay. So basically, we're all kind of in agreement. Probably needs a root canal, crown, or maybe extraction. So, all right, let's go back. Oil pulling is myth. Is oil is go forget that. No comment. This is a fun one. Why would this tooth suddenly change color seemingly overnight? All right, so take a look here, guys. There's a tooth. It's a little gray, a little black. It's getting a little dark compared to the other teeth. So when you have some situation like this, definitely see the dentist. This is caused by basically internal bleeding in the tooth or bruising of the tooth. Let's say your tooth, in general, happens after trauma. So let's say you got hit in the face, got punched, or fell on the ground, who knows what. And sometimes also, if you're biting really hard on that tooth for many, many years, the tooth can start to bruise. Often this is a sign that the tooth is dead. So if you were to come to my office, what I would do is I would definitely take an x-ray of the tooth, see if I can find an infection on the x-ray. Then I'd do something called a cold test, which is where I would touch a little bit of cold to the tooth and see if we get a response. So normally if you touch cold to a tooth, it'll feel sensitive, you might feel painful. If you touch cold to a tooth that's dead, you normally don't get a response because the nerve inside the tooth is dead. There's no response. So this patient definitely should see the dentist. That tooth might need a root canal. And after the end of the root canal, you might be able to bleach the inside to get it whiter, or maybe crown it just to get it into a better color. Keep in mind also, sometimes teeth, they do change color. They do change color after trauma. Just because. And sometimes they're still alive and you don't need a root canal, but maybe 8 out of 10 times it needs that root canal or some sort of treatment. All right, next question. Is it normal for dental assistants to fit and grind a bridge? In the state of Pennsylvania, no, it's not. They're not allowed to fit and grind a bridge onto you. That's the dentist's responsibility. So I had a bridge that broke within 2 months. The dentist was busy with other patients. I had an assistant to get my bite right before he cemented the bridge. I'm in Arizona, so I don't know the rules for Arizona, but in Pennsylvania, generally that's the dentist domain. All right. Root canal has failed under crown. Options. All right, I'm not even before reading this. Once you've had a root canal, essentially we clean out the nerve inside of a tooth, and the tooth is essentially mummified. All right, if a root canal starts to fail, it probably means that there's a new infection brewing. When that happens, either the tooth needs a new root canal done by a specialist, by an endodontist, or it might need to be extracted. If it's failing in the first place, there might be a vertical fracture. And if there's a vertical fracture down the vertical of the tooth, it needs to be extracted because that will continue spreading that fracture, and then the tooth is hopeless. So, all right. I didn't read it, though. I'm curious to see what they wrote. Backstory, I have 20 crowns installed for cosmetic purposes. That's a lot of crowns. Dentist conducted 4 root canals prior to placing the crowns. One of the root canals has failed and had an infection on the upper gum line. Pain, my normal dentist advised. You cannot remove the crown and fix the root canal. It has to go to endo. That's fine. I think that's fair. Send the root canal to an endodontist. For a situation like this, would it be possible to remove the one crown, either fix the root canal and then replace with crown or remove? This is too much random stuff. No, just go to the endodontist. They'll do the root canal through the crown, and you're good to go. All right. All right, last question. I think you guys are getting tired of me now. Dry socket risk question. I'm typically a fast healer. I don't usually bruise, cuts, burns, scrapes heal within days instead of weeks. Stitches are regularly an issue as my skin grows over them before they come out naturally. Now I just had a wisdom tooth removed 5 days ago, 3 fully impacted. Everyone has a different time frame on when you're safe from dry socket, anywhere between 3 days to 2 weeks. I'm deeply terrified of getting it and would like to know what I can stop thinking about it at all times. You should be fine. Dry socket, I don't know the percentages or the numbers, but dry socket is most common on the lower jaw after extractions versus the upper jaw. For those who don't know, dry socket is when the healing after an extraction is delayed and the tissue hurts a lot. So some things you can do to avoid that are, first of all, follow the instructions that the oral surgeon provides you after removing those teeth, which are generally go on a soft diet, nothing too hard or crunchy. No smoking, cigarettes for sure. I always say a week. No straws or suction because that dislodges the clot that's forming in that socket, and that can slow the healing down. So just follow those instructions. Within a few days, start rinsing it with some salt water and or an aloe rinse, something natural like that to keep it clean. But the risk of dry socket is not a reason to avoid an extraction. If you follow instructions, you should be okay. That being said, there's always the chance you might develop dry socket, and if you do, you'll be okay. It'll pass within a few days. All right, well that's it. I mean, this thing goes on, right? It keeps going and going. People have all these questions for the dentist. If you have any questions, if you somehow found my video, you can comment below. You can message me. I'm happy to answer them. And if you have any ideas for any future videos, I'm just getting started at this. Go ahead and ask. I'm open to any suggestions. All right. Well, thank you so much for watching and have a great day.